Hi, everyone, and welcome to our webinar today. My name is Randi Pochtar. I'm a psychologist here at the Child Study Center, and I specialize in children, adolescents, and families with anxiety and mood disorders, as well as with trauma and community crisis response prevention.
My name is Dr. Daniel Schechter. I'm a child and adolescent psychiatrist who specializes both in stress trauma resilience and in perinatal and early childhood mental health.
Hi, everyone. Good morning. My name is Stephanie Wagner, and I'm a psychologist here at the Child Study Center, and I specialize in early childhood.
So today we're going to be talking about a really important topic, the loss of a parent to suicide. And so, we always want to remind everyone that, of course, losing a parent at any age and in any way is incredibly devastating and challenging for a family. When a parent dies by suicide, there's added complexity and challenges that come along with that. And so we're going to be speaking about a number of different things that we want families, caregivers, providers to be thinking about when working with and speaking to children who've experienced this. You can submit questions at any time today by typing them into the questions panel on the control panel. That's on the right side of your screen, and we'll answer questions at the end of our presentation. So today we're going to be covering a number of different areas. We're going to be talking about the impact of a child's development on children's emotional reactions. We're going to speak about common and expected reactions that children may have across ages who have had a parent die by suicide. We're going to talk about strategies for actually speaking to children about a parent's death by suicide, things that parents, caregivers, and other family members can be doing for children who have lost a parent to suicide. Thinking about when should families seek extra help or professional help when their child may be struggling in ways that are beyond typical or expected grief responses. We're going to be speaking about treatments that are available and considered most effective for helping youth who've experienced the death of a parent, especially the death of a parent by suicide. And we're going to be providing some additional resources that are particularly for both parents and caregivers and professionals, as well as for children themselves.
So one thing that we want to start off by talking about is child development and how does child development affect children's reactions to parental suicide, because children are developing much differently than adults, especially in the early years, and that really influences how they react and what they need.
So for example, if we begin with infants and toddlers, they're very, very sensitive to the presence of a caregiver who's there to protect them, nurture them, to help them regulate their feelings. And they're not yet able to hold in mind the absence of a parent. So if a parent steps out of the room, even it could be out of sight, out of mind. It's as if they've fallen off of the planet. They're not also able or very capable of using language yet to express their feelings. And typically toddlers explore their environments. So if they're not exploring, that can be a sign something's going on. And they do approach their caregivers when feeling frightened or when they're not feeling well. For young children, they're starting to be able to use language to ask questions. They don't yet have a clear sense of time, and so they don't necessarily understand that death is final. They tend to see themselves as the cause of problems. It's the egocentricity of early childhood. And this builds. So at school age, children are more aware of questions that can be asked. They try to use basic logic. They can be more aware of their peers' reactions. They're aware more of social stigma. They don't want to be on the outside of things. And adolescents continue to build their peer relationships such that their network of friends are very important. They do want to individuate from adult caregivers, so they may become critical or more distant and more close to their friends. And there are biological challenges that come with adolescence, the hormonal changes, the changes in the brain, the integration of the front part of the brain to the limbic part of the brain, which is the more emotional part. So that's sort of the framework in which we try to understand children's reactions to any kind of difficult event.
And I think with that, it's also important to keep in mind that we can use their age and developmental stage as proxies, but that children really vary, and there may be some kids that are a little bit older, but still on the mature end of kind of how they process things and react to things.
Absolutely. These are just sort of guidelines, sort of the typical average kid, but there's a sort of curve. Both ends of the curve are important. Yeah.
Absolutely. You want to think about both chronological age and developmental age.
Right.
Yeah.
on to our next question?
I think so.
Okay.
So what are common or expected reactions of children across age groups who've had a parent die by suicide?
So I think, again, across ages, we may see different things. So in younger children, we really want to be paying the closest attention to behavior. They're not going to be less likely to express verbally what they're feeling. Again, of course, in really young children, they're not going to be able to. And even in younger children who are in, infants or toddlers, they still may be less likely to express what they're feeling verbally. So we really want to be looking at what is their sleeping like, what is their eating like, how are they engaging with their caregivers, with the adults in their lives, how have those relationships changed, are they the same, paying close attention to what they're showing us behaviorally, as well as in their play. We may want to pay close attention to what they're doing. Are you seeing certain things come up in their play, being really sort of close observers to the child. In older kids and in adolescents, they may be more likely to verbalize what they're experiencing. This may be to people outside of their parents, so this may be more to their peers or to a therapist or to a counselor, but it also could be to parents, and they may be likely to express a wide range of feelings like sadness, anger, guilt, shame. They may also even experience some relief. And I think the thing that we want to really help adolescents, especially to understand is, and school-age children, is that a wide range of emotions and reactions are normal and expected, that any emotion that they feel is valid and justified, and we want to help them to understand that those are things that we can all handle and allow them to have.
I also think another important thing to keep in mind, especially when you're thinking about younger kids, is that there can be sometimes a regression in skills. So a child that was toilet trained, that now you see a regression, a child that was able to manage kind of their feelings without tantrums might have more tantrums, and that can be a typical reaction as well.
And I think having treated children of all ages who have had parents die by suicide, I think, when we think across ages, some of the guidelines that we gave you for more typical development, we think about the regulation that parents provide. So very young children, but children of all ages may become very dysregulated, maybe even inconsolable at times, and then at other times appear to be calm and playing or interacting as if nothing were going on. Young children may stop exploring their environment. They may become very constricted in their affect, very serious, very sullen. They may be wary of substitute caregivers, even the best intentioned ones. I think that young children and school-age children, they also start to ask questions. The younger children may say, where's mommy, where's daddy, when are they coming back, not understanding that death is final. And that can actually trigger strong reactions in the surviving caregivers who are trying to defend themselves and go about their daily life as best as possible. They suddenly may become triggered and remember what happened to the parent who died by suicide. Similarly, there are other triggers like anniversary reactions or an object in the house that belongs to the caregiver that passed away. Those are all possible trigger points that come and go, and it's important to help children understand that they're entitled to feel sad and even angry. They can feel a range of feelings about their caregivers, the love as well. And at the same time, there's someone there to take care of them, and that there are people to help them when there's a problem that arises. They can find a solution.
So the next question we want to talk about is when, how, and what should parents and other caregivers say to children about a parent who has died by suicide. I think there's often the question that comes up of when should we tell and how much information to give. And so we want to speak a little bit about what this should look like generally. So, sort of general areas that we want to highlight that are important, and then also things that are more specific to the age group.
So this is a tough topic because there is obviously individual choice that's involved. There are cultural factors that are involved. Our advice, based on our experience clinically and the literature, suggests that we should tell the truth to children in a way that they can understand at their developmental age. Why? Because, for one, the child will otherwise be shocked when they find out from either other people or nonverbal communication or some other media that the parent has died by suicide. Two, they'll feel betrayed by the people that are taking care of them if they haven't been told the truth, because the truth will be told at some point. What should we say to the child? Well, the first thing is important in our mind is to explain that the parent who died by suicide was at the time not well in their mind and or brain, and that too they made a mistake in believing that there was no other solution to their problem than to hurt themselves, and that they hurt themselves so badly that they died. That's a simple way to say it. We don't need to go into further detail. Before we even say anything to the child, we want to understand what the child already has understood or not understood, what questions they have, and we don't need to bombard them with extra information or details, because the message that I just told you is a big chunk to take in. So there are other thoughts about?
Yeah, I mean, I think one thing that's really tough, and kids ask a lot of tough questions, and this is probably one of the toughest parents or caregivers will ever have to answer, but one thing is that a child that's grappling with the death of a parent who has a surviving parent, that parent is also dealing with a really large loss and having their own grief reactions and their own kind of feelings about that. So this is a really hard thing for parents while they're going through this themselves to think about how to explain it for kids. And with that, one really important thing is to not make a hasty decision about telling or a rash, to think about how you're going to tell, what you're going to say, and be in a place where you can talk about it and show that you feel sad and you feel upset and that you're coping and you're there to protect your child. So that doing it in a way where you've taken care of yourself enough that you're in a position. It's the kind of saying that you hear on planes of put your air oxygen mask on before you help a child or someone that needs assistance. So I think that's really important because it really will influence how the child views your reaction and who's going to protect them.
Absolutely.
I was going to say one other thing. I think we always want to also just think about the children who may have actually directly witnessed or found the parent, and I think that's something that that parents fear could be the worst possible thing. And I think with that, going off of your point, we want to really start with what they saw, what they know before jumping in to give details. So we're really asking them, what was that? What did you see? What did you hear? What was that experience like for you? So we know what their experience was before we jump in to add details or give more information. And I think similarly, we want to be mindful of not assuming what might have been the most traumatic or challenging part for the child and really ask them. We want to be open and good listeners around this and not jump in to make the assumptions that maybe what was hardest for the caregiver is the same as what's hardest for the child. Working with children with trauma, sometimes the thing we may assume was the most challenging or horrific part may not have been for that child, and it may have been something else. So I think that's just one other piece, we want to be thinking about.
And just to add that no matter how a parent or a close attachment figure has died, it's very important to remind the child that the parent cannot be with them, that it's not their fault that the parent's not there with them, that wishes and feelings such as anger do not cause death, no matter how strong those feelings are, and that the parent will not be coming back. And we will provide some resources or some books for children that help to understand, using animals as metaphors or stories about characters that have passed away, how that can affect them.
Yeah. I was just going to chime in along those lines. With really young kids, this might be their first experience with death, and so that may need to be explained too in terms of what being dead means, in terms of you can't breathe, you can't play, you can't sleep, you will not see them, you will not talk to them, and that's going to be a question for little kids that's going to come up repeatedly, and it's important that parents are able to explain that and able to keep that consistent and do so in a way that doesn't use confusing words or terms that can kind of just make it harder for the child to process.
Sorry, I was just going to say, and I think adding to that, given, a child who may learn about this at a really early age, this is an ongoing conversation. This is one conversation, as Dr. Schechter spoke about in terms of the initial conversation and how much information to share. And then this is something that's going to progress over time. As the child grows and gets older, they may have more questions, and we want to be sure to keep the lines of communication open as their questions are going to change, as their cognitive ability changes, their emotions change, and they start to grow.
And I think just to add to that, it's important to reassure the child that you are there, or whoever is the surviving caregiver is there to take care of them, to protect them, that you will not die, you are healthy now, that they will not die. We don't need to get into the existential details with the young child. They need to know that there are people there to take care of them and keep them safe in the absence of the parent who passed. And also that had the parent been well, they would not have wanted to leave the child, that they were not well and they were confused and they didn't know how to solve their problems. But there are, in another way, but there are always ways to solve problems that are better than suicide.
The next question we're going to speak about is, what can parents and families do for children and adolescents who have had a parent die by suicide? So we've highlighted some initial ideas in terms of being honest and direct and clear about what happened. People have talked about making sure that it's at the child's developmental level. What are some other things that parents, caregivers, and others working with these children want to be thinking about? What can they be doing to intervene and be as helpful as possible?
Well, I think one thing to think about is we want to encourage children to be comfortable talking about their feelings as they become aware of them, and having those conversations, even when those feelings are confusing, and anger and guilt and feeling hurt and sad. So one really important way to do that is the caregiver or parent who's surviving being able to say, you know, I feel sad and this is really hard, and being able to model their feelings, talk about them, and model how they're trying to kind of cope with that and deal with it, so that that becomes something that's open and not a secret or something to be ashamed of or something to suppress.
So like them seeking support from their own systems, you know, I'm going to go speak to grandma today, I'm feeling sad, that kind of thing. You know, showing that they can both handle whatever the child has to give, and also that they're modeling effective coping in terms of talking about and experiencing their emotions. You know, I think another key piece going to the sort of older children and adolescent side is this concept of validation. You know, I think as especially thinking about a caregiver or parent who has just experienced, you know, maybe the death of their significant other and is trying to model coping for their child, you know, be sort of both experiencing their own grief while also being there for their child. They're going to be going through a lot and may have the urge to want to jump in and, you know, always be giving reassurance and problem solving and, you know, giving their opinion and helping the adolescent in that way. And sometimes what we want to do is actually take a step back. And so I really, you know, often encourage people to really listen without judgment. So just show the adolescent that you're just hearing what they're saying without necessarily jumping in to always give an opinion. So if you know, the adolescent is expressing anger, frustration, guilt, you know, just acknowledging makes perfect sense that you're feeling that way. A lot of people feel that way, you know, when they've experienced a death, that type of thing. And then maybe you're jumping in to say, what would be helpful? Is it helpful for us to think about how to help you cope, that type of thing? But starting first by pure listening, I think, is really important.
And also particularly for young children, but for children of all ages, including adolescents, it's important to maintain routines. It's important to set limits as one normally would. It's also very important to find a place to allow the child, when they want, to think about the deceased parent and to think of good memories with them, to be able to memorialize them in a way that they find fitting with the surviving caregivers, and at the same time to also have the ability to say how they feel if it's not positive, and to think about what made them angry or scared about the parent, to try to help them understand. At the same time, the surviving caregivers, as my colleague said, need to be able to manage their own feelings towards the parent who suicided. And if they have very negative feelings, those may not be the best to share with the child, who still needs to be able to think of the deceased parent as their parent, and who at some place in their heart loved them. And so the surviving caregiver may need to seek help, may need to speak to peers in order to express those other feelings that should be kept separate from the child. And the surviving caregiver's intention should be there to really help think about what the child needs developmentally.
I think just to go back for a minute to the consistency and routines, I think this is a hard thing because this child has this loss, the parent has the loss, and thinking, oh, well, it's not a big deal if they want extra screen time or if they want extra treats or if they don't want to do this. Like, they're going through something, and it's really easy to think that will help. And, in the moment, that may make the child happy and feel better, and that may help the parent feel like they don't have to deal with their child's reactions. But what that does is, over time, makes the child feel less secure, less taken care of. And we know kids do best when things are predictable, consistent, there are rules and limits. They tend to feel the best, and getting back into the regular routine will feel good for them, even though that can be really hard.
Yeah, and there may be ways to add in choice to their routine. So, if the child is feeling this lack of control, they just lost a parent, and suddenly, and that was such an experience that was out of anything that they could have controlled. There might be ways to give choices within the structure and limits that the parent has set. And so that's something that parents can think about is, even if it's choosing the color shirt they want to wear the next day, just ways to increase small choices that they might be able to make into their structure and routine. And I think along with routines, I think making sure there's also room for relaxation and play, and sending the message, that it's okay to feel happy, even though you also feel really sad, and that both of those things can happen at the same time, and that, going back and playing is okay. And I think sometimes people feel like I shouldn't feel happy, right? I shouldn't feel joy. I shouldn't be laughing because I just experienced this huge and awful loss, and my parent is struggling. And, I think parents sending the message that, no, it's okay to go back to that and to relax and play.
And the idea that a child may want to be with the parent who has passed is common, and it's expectable. They miss their parent who's not there anymore. And so it can be frightening to surviving caregivers who may worry that the child is greater at risk for hurting themselves as the parents had. And there is an increased risk among children of parents who've suicided, but at the same time, we'll get to when one should start to worry about that. And similarly, there may be the wish or the fear to attend the funeral, to attend memorials, and those are individual choices. The surviving caregivers can remember that it's important to be available for the child at those moments, and if they feel that they can't be, it may be best to have a very personal, private kind of funeral or memorial with the child, ceremony for the deceased parent. It's an individual choice that has to be thought out, who's present, who are the supports that can be there for the child.
So along those lines, one really critical piece that we want to think about is, when should parents and families seek professional help? What are some of the important behaviors or symptoms that we want families to be looking for in children across development in terms of making that decision?
So whenever we're seeing impairment in functioning or suffering that's enduring, naturally when a parent dies for whatever reason, particularly suicide, it's a very big disruption. It's a big loss. There's going to be sadness. There's going to be anger. There may be denial. There may be the wish that the parent will come back, and even the belief that they're alive somewhere. At the same time, that should be limited to the period of mourning, anywhere from some months to 6 months, you can say, to a year. And the symptoms, we could say the feelings, they're not yet symptoms. If they, thinking of the normative feelings that we have of grief, of loss, of a sense of emptiness, of something missing, they should sort of decline, dissipate over time, not get more intense, the image of the deceased parent should begin to turn more towards positive memories. If the child stays focused on frightening images, especially as Dr. Pochtar said, the child had seen something that was very traumatic around the deceased parent's passing, then they should those images should decline. If they don't, if they become more intense and they're very troubling, there are nightmares, there's a change in behavior, there's a fear of being with others, of going to school, then it's important to seek help through consultation.
I think the other point here is, those are really great suggestions and really focused on what we might see in the child. Given kind of the caregiver's involvement too and that effects on the family, you want to be looking out for signs in the surviving parent because there might be things in the child that are triggering memories of the surviving parent in terms of their actions, their behavior, how they're coping with things that may be very hard for the parent to tolerate. Similarly, if the parent's mood beyond grief is getting to the point where it's hard for them to get through their day, get through their routines, provide caregiving, that can also create kind of lasting damage and lasting difficulties to the child. And those would be reasons to seek out treatment for the parent and also for their ability to kind of protect their child and be there for their child.
Yeah. The last thing I'll add in, for adolescents specifically, differentiating normal adolescent risk-taking or typical adolescent risk-taking from more problematic or concerning adolescent risk-taking can be challenging, but I think that is something to be looking for if you're concerned about or seeing an increase in substance use or spending time with, a new group of peers that you believe may be engaging in more risky behaviors. The adolescent is making any comments, of course, about suicide, or there's any concerns for non-suicidal self-injury, things like that, changes in their sleeping, eating. Those are things that you also want to be paying attention to, I think, particularly for the older children and adolescents. And I think we also just want to recognize that this is an incredibly challenging situation for a caregiver, and I think there's nothing wrong with someone seeking help, even to just decide, does my child need more support or do they not, and sort of seeking professional help to help them in making that decision.
And to go back to what Dr. Wagner was saying, I think it's important that we have a focus on the family as a system when there's been a loss, particularly a loss related to suicide, so that while yes, we're as child clinicians, we're focused on the child, we also need to be focused on the caregiver's mental health, the caregivers plural, are providing the environment for the child, but there's also the relationship between the child and the parent that was suggested, or the child and the caregivers that was suggested by my colleague, that can go both ways, so that a surviving parent's reaction to the loss can trigger the child, and the child's reaction to the loss can trigger the parent, and they're also siblings, and each child in the family is different, and each is entitled to have their own individual reaction, and there is not one correct reaction. There are children who may be more vulnerable to becoming more anxious, withdrawn, or may be vulnerable to becoming even depressed. There are other children who may be more disruptive and externalizing, as we say, in their behaviors, and there may be other children who seek to dive into their academics and become good, perfect kids. And so there we want to be able to address the ability of a child, particularly as they're becoming an adolescent, that it's okay to have strong reactions, to not agree with the surviving parent, to not be so worried about that parent's being fragile, because they need to develop and individuate as a teenager. And very often children, particularly of parents who have suicided or have passed in other ways, are worried about making their surviving caregiver unhappy or depressed or ill even. And that's something to address in families as it comes up.
So we also wanted to talk about some effective treatments and what are some things that could help children who've had a parent die by suicide. And I think kind of overall, this is not a one treatment fits all kind of category because reactions differ, families differ, what parents may be going through, how that affects the child. So really thinking carefully about kind of both the parent and the child and the family system, as Dr. Schechter mentioned, is really important in fitting any type of help. And help can be as brief as I need some guidance on how to talk to my child about this because I'm having trouble figuring out the words or kind of what I should say when. And it could be something more depending upon kind of the impairment and how it's affecting kind of the system.
And treatment always starts with a very good assessment. And there may be issues that are related specifically to the loss, and there may be other issues that have been there or other risks that are present that can be identified during an assessment that can be addressed before they become problems. And so after one identifies what specifically the problem is, there are several evidence-based treatments that we know about and that we are able to provide at the NYU Langone Child Study Center. Those include parent-child psychotherapy, so it's actually child-parent psychotherapy, for example, which is a model that is helpful for children who've experienced loss and other forms of difficult life events, trauma. There is also cognitive behavior therapies, trauma-focused, and other for anxiety and for depression. And there, for adolescents, there's forms of prolonged exposure therapy. And for children of varying ages who have more disruptive behavior, there's parent-child interaction therapy. Those are all evidence-based treatments, and yet we all, as clinicians, try to use the best of the different treatments that we've been trained in.
Yeah, I think overall you want to look for a provider who has some experience in this area, whether it's working with children and families or adults who have experienced at least grief, if not the death of parents by suicide, or who have experienced treating trauma, experienced in some of these evidence-based treatments, as well as someone that you feel comfortable with. I think, meeting someone and having that connection is also extremely important. So these are just some things you can be thinking about in terms of, there's a lot of therapists out there, so questions that you might ask in terms of deciding who and where you want to seek treatment.
And the who is also important because it may be focused, where is the problem that you're seeing located, and where does the clinician see the problem located? So it may be that you're seeking help for your child or for yourself, or you want guidance for yourself as a surviving caregiver. It may be that the family as a system, so another evidence-based treatment, systemic therapy or family therapy, or the surviving adults may need to come in without the child. The question comes up whether, in order to, if you're not sure whether there's a problem and you don't want to pathologize or make the child appear that the child is having psychiatric issues when they may not be, you can come in for a consultation to help understand what's going on with the child rather than force a child or adolescent to come in which case it'll be an unpleasant experience for them. So there's other ideas about that, but
definitely, I think it's not a one-size-fits-all thing. It's kind of fitting a family's needs to what you can provide and what is likely to help, and thinking carefully about it, because some people may be able to go off resources and books and talking to their support network alone, and others might have a more complicated process and just need a little help along the way.
And culture matters as well as the idea that you may have spiritual help. There may be other support networks, including congregations or community agencies that you feel comfortable seeking help from.
I think the last thing I would just say about that is thinking about, stigma in terms of ideas like maybe don't want to bring my child in, or I don't want to pathologize things. There are ways to normalize it and ways to kind of help the child feel more comfortable in terms of like, this was a really happy thing, and we're going to see if someone can help us, and kind of also you being open to it and kind of involving modeling other people that have gone through this can be really helpful too. But that's also something you could enlist a professional to talk about, like how to help the child feel comfortable.
How do I talk to my child about bringing them in, that kind of thing.
Yeah.
So lastly, we have some resources that we think can be helpful both for parents and professionals on this slide. I believe these slides are available, so you can always look after, but these are some resources, books, and articles that might be helpful for, as well as websites that's helpful for parents and professionals. And on the next slide, we have some book suggestions that are actually specifically for children, and they range from being just around death and loss itself, as well as more specific to we want to thank you, and now we're going to jump into some questions.
Okay, the first question, how do you recommend explaining death to toddlers, preschoolers? And if they ask, what happens when somebody dies, where do they go live now?
So that's a very good question. Often, again, to think of a metaphor, what is life and what is not life. So you don't want to compare death, for example, to sleeping, where the person is breathing and moving. You want to rather help the child understand that a rock, for example, can't move, can't breathe, can't play, is not alive. And similarly, when an animal, if they've ever seen, whether it's an insect or a pet, die, they understand that the animal can no longer move or breathe. And that doesn't mean that somewhere there isn't the spirit of that animal or person, but we don't necessarily understand enough to know about where that spirit is, or you can provide a cultural or spiritual explanation for that according to your beliefs. And the second part of that question?
Where do they go live now?
So it can be helpful to understand what is done. Again, it's this cultural issue, but in most cases in North America, one has a funeral ceremony. If there's a burial, that the person's body is placed in a casket in the ground, and one can use a cloth or something in play to help the child understand what that process is. That doesn't hurt the body because the body is no longer alive, but it helps the family know that the remains of their loved one are there, and they can visit the grave. There are other explanations according to the practices, again, within the culture and the family and spiritual beliefs that can be worked through. Other ideas about that? That's a hard question.
It is a hard question, and I think also with younger kids, less can be more in terms of, like a simple rock kind of metaphor that Dr. Schechter was saying, and trying to make it not avoid things that people say to try to help kids feel better, like they're in a better place, or it's so wonderful, because that can be really confusing to kids, and that may be something that you want to explore in terms of your own religious beliefs or kind of cultural values, but trying to keep it pretty concrete and direct, at least for young kids, so that they can grasp that concept before they understand some of the differences that are more abstract.
Yeah, and I think along those lines, like answering and waiting and seeing what their reaction is before, sometimes I think we want to say a lot to feel like we're giving a really thorough answer, or because we're anxious about giving a response, but I think giving that simple, concrete, and direct response, and they may be perfectly satisfied with that for now. You may have to, again, go back over time and change that as they start to ask more questions, but giving a response and then waiting and seeing how they react to it.
Or even asking, where do you think mommy or daddy is? And helping the child also imagine that they can always call up their memories, that there's part of mommy and daddy in their heart, in their mind, that nobody can take the memories away. That's extremely important, and that if mommy or daddy were here, they would be loving and thinking about the child, just as the present caregiver is loving and thinking about the child.
I think we have a couple more questions. The next question is, what is the best way for a school to provide for a child's need in this kind of loss? Which is a really great question, because schools provide a lot of care, support, and development for children. And that's, again, going to vary a little bit by age and by kind of the community of the
one thing that's important would be for the surviving parent to meet with the child's teacher and to think about together how the child is doing, a plan to follow up, and a plan also to address reactions among other members of the class, the peers, and to keep an eye on anything that is said that may be confusing or hurtful to the child by peers or other staff in the school, and that the teacher become a person to whom, if it's possible, it's not always possible, the child can turn if they're not feeling good emotionally, if they're not feeling supported.
Absolutely. I think most, certainly the school working really closely with the parent caregiver, taking their lead in terms of what the parent and or caregiver wants for the child at school, what they want the school to be doing, I think is really important. And then just helping the child adolescent to feel like they have a support system at school, whether it's a teacher, guidance counselor, school psychologist, whoever it may be, coach, who the child or adolescent feels like they can go to. Having not necessarily a safety plan because we're worried the child is at risk, but a safety plan or a coping plan, knowing, where they can go if they need to, who they can speak to, having some sort of system in place. And I agree, monitoring, keeping an eye, seeing what the other reactions of the peers are. And I think continuing to check in with the child or adolescent. How is this working for you? Is it helpful that we meet like this? Do you want to just let me know when you want to meet, or is it better to just set up a time? So I think, especially as the child gets older, asking them for their feedback and working both with them and with the parents and caregivers to make sure that we're doing the best job for them.
Mm-hmm. And one other issue that's come up is social media has become very, very important, and it can be a support, and it can also be damaging. It can be a source of cyberbullying. It can be different things. So it's important that both the parent and the teacher sort of take the pulse or keep track of how the child and the other members of the class are using social media to talk about what's gone on with that child's experience of loss.
I think the other thing to keep in mind in school settings is that, given that this is something that's viewed differently in different cultures and people come in with stigma and with different views, that there may be kids that are saying things like that caregiver was selfish or different things that could be hurtful for the child, and being aware of that and thinking if that needs to be addressed on a broader scale with giving some kind of information by the school counselor about what this is and how to talk to kids about it and how to help support a friend or a classmate. So we really thank you for tuning in. On behalf of the Child Study Center, we're really glad you joined us. Once you leave the webinar, you will receive a survey, and we would appreciate it if you would complete it. You will also receive a follow-up email within a day or two with a link of today's live presentation, and you can visit NYU Langone website for more information.
Thank you.
Thank you.